You're sitting in front of a paper. You haven't read a single word yet, and in the next few minutes, you're going to decide, is this paper worth the next 20 minutes of my life or not? That decision happens in two places, the title and the abstract, and by the end of this episode, you'll know exactly how to make it, every single time. Let's start with the title. Most students read a title the way they read a street sign. They glance at it, register that it exists, and move on. That's a mistake. Because a well-written scientific title is not a label. It's a compressed argument. Every word is there for a reason, and if you know how to decode it, the title alone tells you the study design, the population, the intervention, and the outcome before you've touched the abstract. The tool for decoding any clinical title is called the PICO framework. 4 letters, 4 questions. P, population. Who were the subjects? What were their characteristics? Age, diagnosis, clinical setting. I, intervention. What was done to them? A treatment, a drug, a surgical procedure, a behavioral change. C, comparison. What was the intervention compared against? A placebo, a different treatment, no treatment at all. O, outcome. What was measured? What did the researchers define as success or failure? These 4 elements live inside almost every clinical title. Your job is to find them. Now the abstract. The abstract is a summary of the entire paper in 150 to 300 words. It comes before everything, before the introduction, before the methods, before the results, and it is structured into sections that mirror the paper itself. Most clinical abstracts follow 4 parts. Background, why does this study exist? Methods, what did they do and how? Results, what did they find? Conclusion, what does it mean? Here is the key insight that most students miss. The abstract is written to be read in a specific order, but you should read it in a different order. Start with the conclusion, then go to the results, then go to the methods, then, only if you're still interested, read the background. Why this order? Because the conclusion tells you immediately whether this paper is relevant to your question. If it isn't, stop. Move to the next paper. You've saved yourself 15 minutes. Let's apply this to the Buser 2017 abstract. Start with the conclusion. The authors conclude that SLA implants demonstrate high, long-term survival and success rates over 10 years, supporting their use as a reliable treatment option in partially edentulous patients. Interesting, but before you accept that conclusion, you go to the results. The results show survival rate of 98.8% at 10 years, success rate defined as implant stability with less than 1.5 millimeters of marginal bone loss was 94.1%. These are strong numbers. But now you ask, how are these measured and by whom? You go to the methods, 303 patients, 511 implants. Retrospective analysis, meaning the researchers looked back at existing patient records, not a prospective controlled trial. Follow-up ranged from 10 to 16 years. Outcome assessment included clinical examination and standardized radiographs. Now you go to the background. The authors explain that SLA surfaces were introduced to improve osseointegration through increased surface roughness. Long-term data beyond 5 years was limited at the time of the study, hence the rationale for this 10-year analysis. Now you have read the abstract in the right order. And now you ask the 4 questions that every abstract deserves. Question 1. What is the sample size and is it sufficient? 511 implants in 303 patients. For a 10-year retrospective cohort, this is a reasonable sample, not massive, but meaningful. Question 2. Is there a comparison group? No, this is a single-arm cohort. There is no control group receiving a different implant surface. This means you cannot conclude that SLA is better than other surfaces, only that SLA performs well on its own terms. Question 3. What is the follow-up period? 10 to 16 years. This is genuinely long-term data. In implant research, 10 years is the benchmark for credibility. This passes that test. Question 4. Does the conclusion match the results? The authors claim high survival and success rates, and the numbers support that. 98.8% survival and 94.1% success over 10 years are clinically meaningful figures. The conclusion is not overstated. It matches the data. But here's the question the abstract doesn't answer for you, and this is where critical reading begins. Who were the patients? Were they healthy non-smokers with good bone volume in ideal conditions? Because if the 303 patients in this study don't look like your patients in your clinic, the 98.8% survival rate may not apply to your practice the way the conclusion implies. That question, you answer in the methods section of the full paper, which is next episodes. So here's what you now have. A title gives you PICO in 10 seconds. An abstract gives you the full story in 60 seconds if you read it in the right order. Conclusion first, results second, methods third, background last. And 4 questions to ask every abstract: sample size, comparison group, follow-up period, and whether the conclusion matches the data. These are not complicated tools. They are habits, and habits become automatic with practice. Next episode, we go inside the full paper, the introduction, what it's actually doing, why most students read it wrong, and how to find the one sentence that makes the whole paper make sense. How to read a scientific paper, dental depth. Episode 4 is next.